In our morning rounds, kids and weight. A new study this morning says the road to obesity starts before the age of 5, to emphasize that. Research in the New England Journal of Medicine finds that overweight kindergartners are 4 times as likely to become obese by the 8th grade. Dr. Dyan Hes is a pediatrician specializing in childhood obesity. Good to see you, Dyan Hes.
Good to be
Welcome
here.
back.
Thank you.
Just the word obese and children should not go together.
Yeah,
So
it's frightening.
It is. It's very scary to me. So what does this study mean exactly? We should start very early feeding them, right?
Yes. So what this study shows is that when you bring a child in who's 7, 8, or 15, it's already almost too late. You want to make an early intervention. This study shows that overweight kindergartners were 4 times as likely to be obese adolescents in this study, which was about 8,000 children.
What's the definition of obesity for a child?
So we start measuring body mass index after age 2 in children. So we have a tool that we use. It's weight over meters squared. And we plot a child's weight and height on these curves, and they're standardized curves set by the CDC. And if a child is 85th percentile or greater, that's overweight. And if they're 95th percentile or over, that's considered obese.
Doctor, I think, you hear, and I have young children, and people say, oh, it's baby fat. When is it no longer baby fat?
Well, when they're 5, it's no longer baby fat. So you can be a very chubby infant. I have breastfed babies who are off of the curve, but they're only feeding breast milk and they're doing great. And then when they start walking and crawling, they start burning it off. But when you're 5 and you're off of the chart or you're over the 95th percentile for body mass index, that's not baby fat anymore. And it's very cultural. So people take it they're very sensitive about it.
And on that note, then, how important is it to begin a healthy diet at what age? It's birth. It's the first solid foods that get into their mouth,
exactly.
right?
And a big thing is not starting solid foods too early. So the American Academy of Pediatrics recommends waiting till 6 months if you're breastfed to start solids, and if you're not breastfed, after 4 months. But giving them healthy, non-processed foods, not giving them juice, low-fat milk after the age 2, very important.
When we began, I asked you about how much of this was genetic and how much of it was environmental. Are there other things other than food that affect obesity?
Absolutely. Well, lack of exercise.
Yeah.
So we have kids who live in unsafe neighborhoods, who can't ride their bikes after school. For New York City, for example, in public schools, you only have 45 minutes of gym in a week. And children need 1 hour of exercise a day. So it's really getting them out there, getting to YMCAs, to the Boys and Girls Club, getting them after school where they can exercise in safe places or exercise at home, keeping them off of the TV, limiting screen time, keeping them moving.
Yeah,
Really?
note to parents.
Yeah, very important message. Dr. Dyan Hes, good to see you. Thanks so much.
Thanks so much for having me.